Hi, welcome to MANTHRA Academy online crash course for nurses. Medical Surgical Nursing, continuation of neurological system disorders. Part 2, we are going to discuss what all are the diagnostic tests which is using in the neurology. First diagnostic test is skull and spinal radiography. Skull radiographs reveal the size and shape of the skull bones, the suture separation in infants, fractures or bone defects, erosions and calcification. All this will be helping by the skull radiograph. Spinal radiograph identify the fracture, dislocation, compression, any curvature and erosions, narrowed spinal cord, degenerative process and all will be knowing through the spinal radiograph. What is the nursing intervention for a skull and spinal radiography means? We have to provide support for confused or ventilator dependent patient. Maintain immobilization of the neck if a spinal fracture is suspected. That is very important. If there is a spinal fracture, immobilization is the neck is very important. Remove the metal items from the body part. Mention if the patient has a thick hair because it can affect the interpretation of the X-ray film. So here we have to tie it up. Then the post-procedure, we have to maintain the immobilization until the result are known. So mainly this test we are doing for the head injury accident cases and all. Always it is important to keep the neck immobilized. That is very important, okay? Or you will cause further injury also to the patient if it is immobilized. For this radiography and all, we are shifting and all these things. Important thing is immobilization of the neck.
If you didn't subscribe Nursing Manthra YouTube channel until now, please subscribe now and enable the bell icon to get the updated notifications.
Next test is a CT scan, that is a computerized tomography. Type of a brain scan that may or may not require injection of a dye contrast with the plane of a CT brain plane and a CT brain with the contrast also we are doing. Indication means if there is any suspicion of intracranial bleed, space occupying lesion, that is SOL, any infection, hydrocephalus, tumors, any calcification, all these things are identifying through this CT scan. The dark structures, that is hypodense dark structures indicate infection and edema. Hyperdense, that is a bright structure, indicate a hemorrhage or calcification. So in the CT scan, if there is a dark structure, that indicate the infection and edema, and if it is more bright, then indicate the hemorrhage or a calcification. Nursing intervention for CT scan means we have to obtain an informed consent. Most of the places the radiology technician, they are taking the consent. If they are not available, then we have to take the consent. Assess the allergies to dye, iodine or a shellfish if contrast is planned. Instruct patient to lie still flat during the test. Also instruct the patient to hold his breath when requested. So initiate an IV line if prescribed. Always better to have an IV line because we don't know what will happen in the CT room. So with the IV line only we can shift the patient. That is always better. Then most of the machines, there will be system will be there to announce the thing like deep breathe and exhale, inhale, like that. Instructions will be there in different languages and all. They will arrange like that. So it will be easy what time it has to get inhalation and exhalation and all. They will tell to the patient. Remove all the metallic objects as well as accessories of the head, pins, hair pins and all, everything we have to remove. And check for any claustrophobia. Patient is having closed spaces. If the patient is having fear or not, we have to check. That is claustrophobia. Inform the patient that there may be mechanical noises during the scanning, and the scanner is producing some noises and all. There will be that, so no need to worry. Everything we have to inform the patient before the test. Inform that there will be hot fleshed sensation as well as metallic taste in the mouth when the dye is injected. So what will happen means when the contrast or dye is infusing through the IV line, suddenly the patient will get the metal taste will be there in the mouth, and the full body he will feel hot flesh will be there. So suddenly the patient will get tensed. So we have to inform early itself whenever injecting the injection through this dye. Patient will get this hot flesh and a metallic taste in the mouth. That we have to inform the patient. Administer the antihistamines and corticosteroids before the injection of dye as prescribed to reduce the severity of a reaction. If the patient having previously any type of allergic reaction to this dye, then doctor will prescribe for the antihistamines and corticosteroids and all. Sometimes it's based on the doctor's decision. We have to give the antihistamines and the corticosteroids. Post-operatively, like a post-procedure care, we have to provide a replacement of the fluid because diuresis helps in the elimination of the dye from the body faster. So all this dye has to eliminate faster from the body. So as per the doctor's order, we can initiate the IV fluids. Monitor for allergic reaction of the dye. Then assess the injection site for any bleeding or hematoma is there. That also we have to check. Then this dye actually, one is oral contrast is there and IV contrast is there. Oral contrast, patient will be keeping for at least 4 hours of fasting. Then after that, they will mix this dye contrast in the juice and or at least 2 liters of juice. They will be mixing the dye medicine plus this one. And like that, they will ask the patient to drink every 15 minutes for at least for 2 hours. The patient will be continuously drinking that one. After that, they will do the scan. That is oral contrast. IV contrast, after reaching in the CT room, they will give the IV infusion there, the contrast infusion. Sometimes they will be giving by the oral contrast followed by the IV contrast also giving to give a more clear visualization of the structures, inner structures and all, especially for the CT abdomen and all mainly doing. That is related to the CT scan.
If you wish to know more details about this book, feel free to contact me in WhatsApp. WhatsApp link I mentioned in description box.
Then we have a MRI scan. MRI is a non-invasive imaging technique that identifies the types of tissues, tumors and any vascular abnormalities and all will be identified. This is similar to CT scan but provides a more detailed images. MRI does not use ionizing radiation. Indications for MRI means any congenital abnormalities, any suspected tumors, abscess, aneurysm, venous malformation, hemorrhage into the brain or a spinal cord, subdural hematoma, embolic stroke, hydrocephalus, herniation or a degeneration of a disc in the spinal cord, Alzheimer's disease, epilepsy. For this identifying, MRI is doing it. Contraindication of MRI means that is important, okay? If the patient is having any implanted device, that is a permanent pacemaker, cochlear implants and all, that means it is contraindicated. Implanted devices, that means the MRI is contraindicated. So we have to ask the patient whether they have these implanted devices in the body. Nursing interventions means we have to remove all the metal objects from the body. Determine whether the patient has any implanted device. Remove IV fluid pump during the test. Assess the patient for claustrophobia. Instruct the patient that he will have to lie still during the procedure. Tell the patient that normal activities can be resumed after the scan. So in the MRI mission, those who then the MRI scan will be knowing that there is sound will be there, the musical sound they will be keeping, and so many other sounds which will cause more fear to the patient. So we have to inform the patient prior that sounds will be there, so no need to worry. At least it will take like 30 to 45 minutes and all, taking also more time taking for this MRI scan, whole body scan and all. Then that is related to the MRI scan. Next is lumbar puncture, LP. Lumbar puncture is the procedure often performed to obtain information about the CSF, cerebrospinal fluid. So a spinal needle is inserted through the L3-L4 interspace into the lumbar subarachnoid space and CSF is obtained in lying position and sitting position. Most preferable is the lying position only. Indication that is suspicion of a meningitis, any subarachnoid hemorrhage, suspicion of Guillain-Barré syndrome or carcinomatous meningitis, therapeutic relief of pseudo-tumor cerebri and all, that is indication for LP. Contraindication means presence of infected skin over the needle entry area, then a CT brain showing midline shift, loss of suprachiasmatic and basilar systems, posterior fossa mass, loss of superior cerebellar system, loss of quadrigeminal plate system. These are the structures. Okay, all these things loss is showing by the CT brain or midline shift and all there means we should not do the LP. Or if there is any infection in the over that L3 L4 skin area, if there is any infection, then also we should not do, because suddenly this infection will be transmitting through this needle insertion site through this full body. Then coagulopathy, increased ICP. If there is increased intracranial pressure also, we should not do the LP. Coagulopathy, brain abscess and all, we are not doing. That is contraindicated. The nursing interventions, we have to obtain an informed consent, have the patient empty the bladder. During the procedure, position the patient in a lateral recommended position and have the patient draw the knees up to the abdomen and to the chin onto the chest. Assist with the collection of a specimen. We have to label the specimen immediately in sequence. Maintain a strict asepsis. And after the procedure, we have to monitor the vital signs, neurological signs, position the patient flat as prescribed for some hours, encourage a fluid to replace CSF obtained, then monitor IO chart and all. That is related to the LP. So CSF fluid analysis, this also asking for the question. Mainly they are asking, in the MOH they were asking regarding glucose. In viral meningitis, what will be the glucose level? That will be in normal like that. So you can see here, okay.
Continuation of this video and more system-wise crash course, feel free to contact Nursing Manthra. WhatsApp number +971 5025 15717. Please check the description for WhatsApp link. DHA, MOH, HAAD, Saudi prometric, Oman prometric, Bahrain prometric, Qatar prometric, nclex-rn, CBT exam. We are providing system-based crash course videos. Respiratory system, cardiovascular system, ENT system, ophthalmic system, nervous system, gastrointestinal system, urinary system, reproductive system, musculoskeletal system, endocrine system, dermatology, child health nursing, maternal health nursing, community health nursing, mental health nursing. Fundamentals of nursing includes calculations, nutrition, research and statistics. Online crash course, anytime you can study with an internet connection. For reference, you can watch system-based crash course videos in Nursing Manthra YouTube channel. For full detailed crash course video with picture, feel free to contact me in my WhatsApp.